Hi, today we'll be discussing the National Standing Orders, which is a very important tool that is used at the primary healthcare level in the Nigeria healthcare system. And this particular tool is mostly used by community health practitioners who deliver quality and standardized care at the primary healthcare facilities in Nigeria. I'm by name Eze Ararunyeka. I'm a registered community practitioner. In today's discussion, we'll be looking at the nitty-gritty of the national standing orders and the use. The Community Health Practitioners Registration Board of Nigeria, which is the regulatory authority, defines the standing orders as a comprehensive set of specific guidelines arranged by age groups, conditions, findings, that is, from history, physical examination, laboratory investigation, clinical judgment, and necessary actions to standardize care for patients at primary healthcare facilities. We shall look in depth into this definition and the components. First, it is a comprehensive set of specific guidelines. This means that the standing orders are not vague or generalized. They are a detailed and complete collection of protocols and instructions. That is, these are based on best practices and protocols that need to be followed, So it indicates that the standing order is not vague or generalized. They are a detailed and complete collection of protocols and instructions, which means that they are from evidence-based and have been used over time. As such, has research findings back up. The comprehensiveness of the standing order ensures that healthcare providers, that is, community health practitioners, have access to all relevant information needed to make decisions, implement treatment, and manage patient care effectively. So it is very comprehensive that it's focused, it's straightforward, and it is evidence-based. As such, it enables the community practitioners to assess all relevant information needed to make decisions about patients, their condition, implement treatment plans, improve their critical thinking ability, and manage patient care effectively. Another part of the definition is it is arranged by age group. This means that health needs and interventions, of which we know are often vary significantly across different age groups. So by organizing the standing orders by age, standing orders can ensure that the interventions are tailored appropriately. So a particular person is managed appropriately. So for example, pediatric care will always differ in approach and treatment from that of adult or elderly care. So by that definition of the standing order, that is arranged by age group. So a pediatric patient or a pediatric client will be taken care of using the pediatric care protocol or treatment plan. For that of an adult, will be taken care alongside. The same way for an adolescent. So that is why they said it is arranged by age group. Then conditions. According to the definition, it's arranged by age groups and conditions. This suggests that the standing orders guidelines address specific medical condition that the healthcare provider might encounter at specific times. So if you look into a standing order, you find that has lots of boxes, and each of that boxes contain a specific condition. So these conditions could range from common ailments like hypertension and diabetes to acute illnesses or issues such as infections or injuries. So the standard that's being arranged by conditions, it allows the healthcare provider to provide targeted care that aligns with established medical guidelines and best practices for that particular diagnosis. Another part on that in that definition says that findings from history, physical examination, laboratory investigation, these components of the definition highlights the importance of clinical data in making informed medical decisions. So the standing orders provide instructions based on various patients' findings. Okay. Then another component of the definition is clinical judgment. This means that the standing orders acknowledge the critical role of healthcare provider expertise in making decisions regarding patients' care. While the standing orders provide a structured approach, it is expected that health professionals, such as the community practitioners, that they should be encouraged to apply their clinical judgment in unique patient situation. So ability to think and reason out based on experience, based on patient circumstance, and based on available resources must never be neglected. However, the standard provided a structured approach that most times it will tell you mild condition, severe condition, moderate condition, hypertension suspected, and all of that. That's how the clinical judgment is being provided in the standing orders. This flexibility is important as it accounts for individual variations and complexities that may not be fully captured in standardized guidelines. So that part that allows us to, as healthcare workers, to think based on the data we have collected, based on examination we've made, it allows us to come up with a judgment that is unique for that patient's situation, having considered the data we've collected based on the structured history and examinations, because no two patients are the same. This portion of the definition indicates that the standing orders includes explicit instructions. We are talking about the treatment. If you look at the definition, it has treatment in it. So this portion of the definition indicates that the standing orders include explicit instructions on the required interventions, treatment, or referrals based on the gathered information. So when the patient comes and brings a complaint, using the standard to assess the patient, you see that the complaint the patient presents, the next is possible findings on examination. Then the next is clinical judgment. Then the next is action. So the action part of it is based on the likely thing, condition, situation that led to that, or the diagnosis, probable or suspected. So that portion of the definition indicates that the standing orders include explicit instructions on the required interventions, treatments, or referrals based on the gathered information. These actions could encompass a range of response from prescribing medication. Most times in the box you see, give paracetamol twice daily, 500 milligrams. It could also be ordering for further tests. At times in the actions part of that standing orders, you will see order for so test. Also, you might also see arrange for follow-up appointment, review patient in 3 days' time. If no improvement, refer. So these are the things, these are the likely responses or directives you are going to be saying are the action or treatment part of the standing orders. Thus, specifying necessary actions contributes to clearer expectations and accountability among the healthcare staff, because those set of instructions or actions or treatment options are of standard and is evidence-based. As such, it promotes clearer expectation. This is what I'm likely to see, and accountability among health staffs. The last part of the definition says standardized care for patients at primary healthcare facility. The ultimate goal of the standing order is to establish a standard approach to patient care. Standardization helps ensure that all patients receive consistent, high-quality care, regardless of which provider they see within the PHC facility, because it provides a specific guideline. These enhance patient outcome and reduce variability in treatment and minimize potential errors. Also, standardized care streamlines process, making it easier for the staff to deliver effective and efficient health care. So these are the components of the standing order according to the definition given by the Community Health Practitioners Regulation Board of Nigeria. Let's take the definition again. It says, the standing orders is defined as a comprehensive set of specific guidelines. So we've looked at this component that it specifies conditions, one at a time, that is arranged by age group. That's arranged by age group, which means the way to handle an adult is quite different from the way to handle a neonate, or an adult or an elderly. As such, it provides us with that specialty that this is a pediatric patient and need to be taken care as a pediatric patient. This is an elderly patient or geriatric patient that needs to be taken care that way. So it's arranged by age group. Conditions, different conditions, both common ones and uncommon ones. Findings from history, physical examination, laboratory investigation. If you look at the standing orders, you will see the box has likely findings from physical examination. This is what you are likely to expect. However, it is important to note that most times it's not really that way. That is where your critical thinking, your clinical judgment comes in, because no two patients are the same. However, in these guidelines, it is based on what have been seen over time in clinical practice. But however, your clinical judgment comes in where you now judge based on the findings from history, physical examination, laboratory investigation. Then the resources available, the patient's condition, you have to consider that before you can take clinical judgment or can come up with, this is the clinical judgment. At times, by the time you've gathered a lot of all this data, you'll find out that that condition is not a moderate condition. It could be a severe one, then referral. That's why section in this our discussion, you find out that at a point we are going to look at where they said this should not displace your ability to think or critical thinking. Then necessary actions, which can be referral, which can be drugs, prescribing, which can be referral, which can be health education, which can be review of the patient. Then the last part, standardized care for patients at primary healthcare facilities so that the patients receive care that is effective, care that is timely, care that meets up with their needs. So that's all about the definition of the standing orders. Now let's look at the objectives of the standing orders. One is to ensure legal protection for health workers in the primary healthcare facilities or duties. Legal protection for health workers is important for safeguarding the rights and ensuring that health workers can perform their duties without fear of legal repercussion. Once you are using the standing orders, because this is a standard based on evidence, you are actually working under the legal protection of a physician always. As such, the standing orders enables community practitioners to work and perform their duties without fear of legal repercussion, provided you're working within the scope of the standing orders and that of the primary healthcare. This also means that registered community practitioners are protected against lawsuits or professional liability when acting within the scope of the standing orders. This also means that the community practitioners are protected from punishment for making clinical decisions based on their best judgment as guided by the standing orders. That's one of the importance or the objectives of the standing orders. So they act with full weight of the law without any fear or fear of legal repercussions. Another objective is to offer a structured approach for history taking and physical examination. A structured approach to history taking and physical examination involves using standardized frameworks to collect patient information in a systematic manner. A structured approach enhances and ensures that quality of data are collected, which ensures that all necessary aspects of the patient's conditions are covered and reduces the likelihood of overlooking critical information. So if you look at the history part of the standing order, it is comprehensive. It contains a lot. So, but as a clinician, you look into that box, you know the right questions, you take the best that suits that condition to enable you make sure that no part is missing or overlooked to avoid wrong diagnosis. They actually understand that as health workers, you make use of your judgment ability, critical thinking. So they provide you with lots of history. So it is now up to you to ask the right questions. You are not expected to ask every question as provided, but based on your training, clinical skill required, be able to ask the right questions that will help come up with a good and best clinical judgment that is of interest to both the patient and the healthcare system. The next objective is to aid in the management of less common, easily overlooked, and more serious conditions. Healthcare professionals often encounter conditions that are atypical, that is less common, or that present in a different way, or that are easily missed, particularly in primary care or in a setting where resources may be limited. At times, there are conditions that will come, you've not seen them before, or you have seen them once, for a very long time. So the aim of the standards is to make sure that you don't really go off the balance, because at times most of them are atypical. So the standing orders provide aids in the management of these conditions. So that healthcare workers can recognize and properly address such conditions, thereby reducing misdiagnosis and improving patients' outcomes. Another objective is to maintain a constantly high standard of healthcare. Maintaining a high standard of healthcare encompasses various elements, including quality assurance, adherence to evidence-based practices, patient safety, and continuous professional development. So with the standing orders, as registered committed practitioners continue to use them, they are actually providing quality assurance and making sure that they are using evidence-based practices. And as such, the patient safety is guaranteed. And also from there, they continue to improve in their professional developments. Next objective is to minimize unnecessary, expensive, and time-consuming laboratory investigations. These points emphasize that the importance of evidence-based medicine in decision-making about laboratory tests. Most times, because most health workers are not aware of not seeing this condition, they begin to run different tests. Remember, this is a primary healthcare setting where resources are limited. But with the use of standing orders, some of these are averted. As such, it minimizes unnecessary tests. Note, unnecessary. RUCHPs enhance efficiency, reduce cost, and avoid the inconvenience to patients associated with extensive testing. Because the standards have provided us that this is the test we need to go. We'll go straight to do it. And not, thinking this might likely be this condition, or run this test, and run this test. But because it is evidence-based, it tells this is the test you're supposed to run. And when you go, it helps in the management of the patient. The standards provide a clinical decision support system that guides providers on appropriate test selection based on guidelines or existing patients' data. So because it's a likely conditions, likely findings, if it is cough, for example, fever, blood and sputum, it might likely be a TB. So therefore, go for sputum microscopy, go for chest x-ray, go for this, because it is based on evidence. Then you don't know, it could be thinking, it could be a worm, it could be this, it could be that, it could be cancer, it could be this. But because you're using the standing orders, it gives you a structured approach, which now minimize unnecessary laboratory investigation. Or another objective is to provide a framework for evaluating care and staff performance. A framework for evaluating care and staff performance involves creating structured methodologies to assess clinical outcomes, patient safety, and staff competence in delivering care. These standing orders functions are like more of key performing indicators, KPIs, which can be used to know how these healthcare workers are actually functioning, the skills they have and the skills they are lacking. It also helps in that identifying areas for improvement and also supports the ongoing professional developments by the regulatory authority. Now, let's look at the steps in using the standing order. First, you are to look up the client's problem based on the patient's age group. Then you identify the problem in the relevant section. It could be the neonat 0 to 28 days, could be 1 month to 5 years, could be 6 years to 12 years. It could be adolescents, it could be adults, it could be elderly. So you identify the complaint, the relevant section, and refer to that appropriate page. So if you open the standard, you see that you will see the sections and the page. You go and look up the complaint there. You are expected to ask all questions listed in the history box. In each of the page, there is a complaint, there's likely history you are going to ask, and there is likely examination you are going to perform. Then clinical judgment, suggested clinical judgment, and suggested actions. Record all significant information, including negative findings. For example, if examining the neck of a patient and his stiff neck, you are expected to write stiff neck. If there is absence of stiff neck, it's also expected of you to note down no stiff neck. Then select the box containing all significant findings. The significant findings we're talking about is what, if in the standard they wrote 37 degrees or 40 degrees Celsius as for temperature, blood pressure 140. When you go and assess the temperature and it does not read up to 40%, it's most likely that it's not that condition. Or maybe when you assess the patient's blood pressure, it is instead of the suggested 150/80 millimeter mercury, it's now reading 70/50. This is where your critical thinking comes into play. You shouldn't, because in the box it's written 150/80, you now still go and write 150/80. This is part of observations we've seen among students over time. You should note down what you found. Remember, it is a guideline. It said, select the box containing all significant findings related to the patient's condition from the list of findings. Follow the actions corresponding to the selected findings and manage patient's complaints as instructed, provided that from the information you've gathered, the data you've gathered from history taking and physical examination aligns with the suggested findings and clinical judgment. You now use that actions. But if it doesn't align significantly, let's say suggestions were about 100 and your findings were far different from all the suggested findings, you kindly refer that condition to an appropriate facility. It means that that condition is not covered in the standing orders. As such, you refer. But if it aligns up to 80, you can use that box to manage that patient while monitoring and following up. Other instructions you can find in the standing order says, every patient should undergo the complete examination listed under the first visit at their initial contact with the health facilities, except in emergencies, in which case the treatment should be prioritized and the first visit examination should be completed at the next visit. So this actually means that in each patient that comes for the first time to the health facility, full assessment should be carried out on that patient. Full assessment should be carried out on that patient. All listed examination should be conducted so that we will have a baseline data of that patient. But however, in a situation that is emergency, this can be shifted for the next visit and the person's condition attended to. Another instruction is address the health issues of all family members present in the clinic whenever possible. So let's say they all came and they have different conditions. Remember, it's integrated healthcare service delivery. you ensure that you address all their problems that each member of the family came with to your facility. Follow up all referred cases. When patients return, to ensure continuity of care and facilitate health care worker learning. As such, when you refer patients to a higher facility and they are treated, it's expected of you to follow that patient to know what was diagnosed and how it was managed and how the patient is faring. As such, you would learn better. It's also good to call the facility you referred to, have a note from them. That will enhance your learning. Another is advise all patients to return to the health facility immediately if their condition was. This is very important. After you have managed the patient and given the treatment based on the directive of the standing orders, you are expected to let the patient know that they should return immediately to the health facility if their condition gets worse. Also, health education is crucial for patient care. So therefore, there are lists of health education that is provided under each complaint. At the end, you see the list of health education. You are expected to provide these patients with these health education services based on topics that are listed, which are relevant to the patient's complaint or background information. Next is that when you are in doubt about care plan for a patient, it is important you consult with other healthcare providers at the facility, or you stabilize the patient and refer appropriately. Also, when you do not have the required resources to manage the patient, promptly refer to the appropriate facility or level of care to avoid delay in commencement of care for the patient. So that's why I said that you have to consider the patient resources, your resources available, your expertise. Then before you can critically think and come up with a clinical judgment that this condition is a severe one. As such, I am referring this condition. When that condition is not covered in the standing orders, you must refer. Very important. He said, the standing orders do not replace clinical judgment and critical thinking. Health workers must still gather essential history and physical examination details to make informed clinical decisions and provide appropriate treatment. So what this means is that the standing orders is a guideline and should not replace your ability to think and judge as a clinician. Take, for example, maybe in a section of the standard order that they're using to manage the patient, in the history, you were not actually, they were not specific like female or male, except for maternal section. Maybe in the symptoms like cough, headache, dizziness, it were not differentiated by sex, whether it is for male, do this, for female, do this, you know. But as a clinician, you know that when a female who is within the childbearing age, that is 15 to 49 years of age, before you administer any treatment to this patient or client, you must identify the last menstrual period. You must ask to determine if that female who is within that age range of childbearing is pregnant or not before you administer treatments that might harm the fetus. You see where your clinical judgment and critical thinking comes into play. So you don't just swallow it hook and line. That is why you need to arm yourself with the necessary skills to think. You know, there are some complaints that will come up. You know, clearly these are signs, clear signs of a particular severe condition. But at times in the standard, it would come up and say severe condition suspected. But you know that from the history you've taken, the detailed history you've taken from the patient, that this could be obstructed or strangulated or an acute condition that immediate care is required. You don't need to start looking up. You refer immediately, because this has to do with you acting in the best interest of the patient. Also, it says these protocols delineate the necessary actions and decisions required to manage the patient's symptoms effectively. The community practitioner must ensure proper documentation of all inferences made and action taken in the management of the patient. This is very important. For whatever decision you've taken, for whatever thing you've done on the patient, you must record it. You must record it according to date and time and duly signed. This is important for continuity of care. Now, let's look at this. Let's look at this important notice critically. See, the standing order do not replace your clinical judgment. Now, let's look at what clinical judgment is all about. Clinical judgment refers to the application of knowledge, experience, and reasoning to assess a patient's condition and decide on appropriate care. That is why, that's the more reason they gave this important note. Says the standing orders does not replace clinical judgment and critical thinking, because they understand that clinical judgment has to do with your knowledge as a clinician, your experience over time, and your ability to reason, so that you assess a patient's condition and decide on these actions that we're giving here is not the best for this patient. I am referring this patient to this level immediately because of what you remind you. These standing orders are based on conditions that have been seen over time. As such, it is not specific to a particular patient. It's more of general, likely. So therefore, as a clinician, you must treat every patient as an individual. As such, it should guide you, but not replacing your knowledge, your experience, and your reasoning, so that you can come up with a clinical judgment that is of best interest to the patient. Another reason why they gave that important note is about individualization. Remember, each patient is unique in their medical history. No two patients are the same. What A suffered is 100% likely not what B had suffered. So as such, when you understand that they are unique in their medical history, their current health status, and individual response to treatment, we must not rule out idiosyncrasies. You might have given A particular drug, and A takes a chloroquine and nothing happens to A, but you might give the same chloroquine, the same dose and dosage form, or the same route to B, and B starts to convulse or begin to have ADR, adverse drug reactions. So therefore, you should base your clinical judgment and intervention considering this individual factor. That's why I keep saying that you must consider the patient's circumstance. You must consider the patient's circumstance, consider your resources, then your expertise and experience before you can come and say, yeah, this is the clinical judgment I'm going, and this is the actions I'm taking. Another reason they gave that important note is that they understand that there's complexities of cases. Patients often present with complex medical conditions that requires